Everyone, my name is AJ King, and I will be teaching the Multidisciplinary Health Part 2 course focusing on transgender and gender nonconforming persons. I'm a consultant based in the LA area, working with a number of different agencies and collaboratives that focus on LGBTQ plus communities and specifically trans and non-binary health and social justice issues. I have a background in public health and working in the HIV/STI field, where I've developed and delivered a number of different trainings related to providing culturally responsive services to trans and gender nonconforming individuals. Multidisciplinary Health Part 2, Transgender and Gender Nonconforming Persons, will be the third class offered as part of the Graduate Certificate in LGBTQ plus Health Curriculum. Oftentimes, LGBTQ plus identities are lumped together, even though trans needs are different from sexual minorities. So it's essential to offer a class that solely focuses on gender diverse people. Of course, trans and gender nonconforming individuals, also known as gender minorities, have basic healthcare needs in the same manner that cisgender people do. Cisgender people being those whose gender identity matches the sex they were assigned at birth. Gender minorities also have unique healthcare needs related to their affirming transition, maintenance, and required competent care. Accessing healthcare can be challenging for gender diverse individuals because, unfortunately, not all healthcare providers are sensitive to trans-related issues or informed about the healthcare needs of gender nonconforming individuals. For instance, a negative healthcare experience could contribute to utilization of hormones without medical guidance, which is dangerous and can increase risk for blood clots, high blood pressure, liver disease, and other serious complications. Due to the unique health outcomes that gender minorities face, such as mental health distress, thoughts of suicide, homelessness, and/or financial hardship of obtaining gender-affirming care, this course will give students the tool sets to understand the history and current healthcare needs of gender diverse persons and offer a culturally competent lens of understanding the importance of terminology, unique aspects of care, and identify resources for clinical guidance. So I hope that this description helps in understanding the course, and I appreciate you taking the time to listen. Thank you.